to Wellness Watch, a show that explores the nuances and burden of illnesses and diseases on mankind and how we in India are dealing with it. Today, we discuss an organ in our body that is a superhero performing dual functions. Hidden deep within our abdomen is a powerful multitasker, the pancreas. By the day, it is a glucose guardian. By mealtime, it is a digestion expert. It works like the body's personal control room, balancing the body's sugar levels and also helping us digest every bite we take. Yet, we think of it only when something goes wrong. Pancreatic cancer is a disease that does not always show symptoms, yet changes lives in an instant. Today in Wellness Watch, we discuss pancreatic cancer and the urgent need to recognize it before it becomes a silent threat. I'm Preeti Kaur. Pancreatic cancer, a disease that often hides in silence until it is dangerously advanced. Today, as the cases rise worldwide, awareness and early action are our strongest defense. So what causes pancreatic cancer? Why is it so hard to detect? And why warning signs must we never ignore? Here's a report by DD India's Harshita Oberoi. Take a look.
Pancreatic cancer begins silently. Strange fatigue, unexplained nausea, loss of appetite, weight loss, bloating, or a stomachache you dismiss as indigestion. But with pancreatic cancer, these subtle changes can be the first dominoes in a chain reaction. The pancreas, a small gland tucked deep behind the stomach, controls digestion and blood sugar. When its cells mutate and multiply uncontrollably, a tumor forms. And here's the challenge. Early tumors rarely appear on scans. As the tumor grows, the effects ripple across the body. Jaundice, dark urine, pale stools, itchy skin, vomiting, bloating, back pain, weight loss, and new onset diabetes, all signs that the cancer is now interfering with nearby organs. Exocrine tumors like pancreatic ductal adenocarcinoma account for over 90% of cases. The rarer neuroendocrine tumors behave differently, sometimes causing diarrhea or anemia instead of jaundice. As the disease spreads, symptoms intensify. By this stage, most tumors have already reached the liver, lungs, or abdominal lining. The exact cause of pancreatic cancer remains unclear. No single trigger has been identified, but certain factors are known to raise the risk. Smoking remains one of the strongest risks. Type 2 diabetes and chronic pancreatitis. Long-term inflammation of the pancreas also raise the danger. Some people inherit genetic changes that increase cancer risk. A family history of pancreatic cancer adds further concern. Obesity, older age, especially over 65, and heavy alcohol use all contribute to higher risk. These factors increase the likelihood of cellular changes that can lead to tumor growth. As pancreatic cancer progresses, its impact becomes more visible. Weight loss, as the cancer uses more of the body's energy, and nausea makes eating difficult. Jaundice, when the bile duct becomes blocked, turning the skin and eyes yellow. Severe abdominal pain caused by pressure on nearby nerves. Bowel blockage, when the tumor presses on the duodenum, blocking the passage of food. These complications often signal that the disease has advanced. Detecting pancreatic cancer is a race against time. CT scans, MRI, PET scans, blood tests, endoscopic ultrasound, staging laparoscopy, and genetic testing for BRCA1 and BRCA2 help detect what early scans may miss. For families with a history of pancreatic cancer, genetic screening becomes a vital tool. Pancreatic cancer is classified from stage 0 to stage 4. In the earliest stages, the cancer is confined to the pancreas. As the tumor grows and spreads to nearby tissues or organs, the stage increases. By stage 4, the cancer has reached distant parts of the body. These stages guide prognosis and shape the treatment plan. When it comes to treatment, the only potential cure is surgery. Possible only if the tumor is still confined to the pancreas. Chemotherapy, radiation, targeted drugs, and Palliative care work together to control pain, slow growth, and improve quality of life. But with a 5-year survival rate near 11%, prevention becomes power. Quitting tobacco, maintaining a healthy weight, avoiding harmful chemicals, eating whole foods, and limiting alcohol. Pancreatic cancer may be silent, but our awareness must not be. Know the signs, act early, because in the fight against pancreatic cancer, timing can save a life. Harshita Oberoy's report, Wellness Watch for DD India.
All right, so pancreatic cancer forms when cells in the pancreas mutate and grow uncontrollably, often starting in the digestive enzyme ducts. Due to its deep location in the abdomen and the absence of early symptoms, pancreatic cancer is often diagnosed at an advanced stage, making effective treatment challenging. As compared to the Western countries, occurrence of pancreatic cancer in India is lower. Still, it accounts for approximately 2.1% of all cancer cases and nearly 3.4% of cancer-related deaths in India. Today in Wellness Watch, we look for these answers. What is pancreatic cancer? What are the stages of pancreatic cancer? Is pancreatic cancer preventable? And can a person live without pancreas? Also in the show, we discuss medical advancements in India in the field. Pancreatic cancer treatment in India includes a range of advanced options like surgery, that is Whipple procedure, distal pancreatectomy, chemotherapy, radiation therapy, and newer approaches such as targeted therapy, immunotherapy, and robotic surgery with treatment plans tailored to the individual case. Up on your screens, we'll have some institutes and hospitals which particularly cater to this. All India Institute of Medical Sciences, Delhi, Rajiv Gandhi Cancer Institute and Research Centre, Delhi, Kidwai Memorial Institute of Oncology, Bengaluru, Tata Memorial Centre, Mumbai, and Postgraduate Institute of Medical Sciences of Medical Education and Research, Chandigarh, that is PGIMER. All right, to help us understand pancreatic cancer better and how severe can it get, we have guests in the studio who will be explaining pancreatic cancer better to us. We're joined in by Dr. Deepak Gunjan, Additional Professor, Department of Gastroenterology, AIIMS, Delhi. And we are also joined in by Dr. Nihar Ranjan Das, Professor, Gastrointestinal Surgery and Liver Transplant, AIIMS, Delhi. Thank you both of you for joining us this afternoon on Wellness Watch. Dr. Das, we've shown a detailed report on pancreatic cancer, but to begin with, I would want you to explain to our viewers in very simple terms, where is the pancreas located, what is pancreatic cancer, and how does it start?
So first of all, I would say yes to what Harshita showed and what you said. So I think she has reviewed everything basic required for a public understanding. The pancreas is basically present deep inside the abdomen, just beyond the stomach, and then when the food passes the stomach, reaches the duodenum, the pancreas expels its secretions into the duodenum, helps in almost all types of digestion in the body. It has two parts. One is a exocrine one, means it goes into the lumen of the bowel, and another one directly goes into the blood. That is called the endocrine part, and that constitutes the insulin and other hormones that are required. And the tumor which arises from the exocrine part of the pancreas is commonly called this pancreatic cancer. This is about 95%. The rest, which is from the endocrine part, the gland which secretes the hormones, that is about 5%. So those are called neuroendocrine tumors. So pancreatic cancer is actually pancreatic adenocarcinoma. It's a specific type of cancer arising out of the duct of the pancreas.
Right. All right. At this point, I'll bring in Dr. Gunjan. Dr. Gunjan, we've showed our viewers the different stages of pancreatic cancer. I would want you to explain them in detail. And also, when we talk of the different stages of cancer, how quickly does pancreatic cancer move from stage 1 to stage 4? How much time does a person have?
Okay. So the stages are defined by the TNM classification, we call it, that includes various parameters. One is the size of the tumor, one is the lymph node metastasis, and third is metastasis to the other organs, like it is in liver or peritoneum or lungs. So that's composite endpoint is a stage 1 to a stage 4. So a stage 1 is when it is localized to a stage 1 and 2 are when it is localized to the pancreas only. So these are resectable tumor. You can the patient can undergo surgery, and that will have a better survival. Stage 3 and 4 are, stage 3 is beyond the pancreas and 4 are when there are metastasis into the other organs, different organs. So these tumors will have a more sinister prognosis and they have a lower chance of survival. So it is very aggressive tumor and it rapidly progresses from stage 1 to stage 4. Okay, so median survival is, we call it maybe 6 months, not more than that. So including all the tumors. But if you will take stage 1, then the 5-year survival that is around 40%. That is also upper margin. But if it is, suppose that a stage 4, that then 5-year survival is very minuscule, maybe 2 to 5%.
Right.
Of the, yeah.
All right, I'll take that forward to Dr. Das. Dr. Das, is pancreatic cancer always detected in the later stages? Why is it called a silent threat?
It's a silent killer like many other diseases. One thing what he said, important thing I want to add is the sooner it is detected, the better is for the person. Because if from the date of detection, within 2 months maximum, I would suggest as early as possible, within 2 months it progresses to dissemination, spreads all over the body, then it's incurable. Then life is only 3 months according to the book. Right. That is one. And second thing is, since it is placed deep inside the abdomen and it starts from a point where not most of the organs are there, the symptoms are quite vague and they are not very specific to cancer, as Harshita said.
Yes.
So by the time it is detected, in 85% of cases, I would say a little bit range, 70 to 85% of patients are actually untreatable or surgery is not possible in those patients. So only 15 to 20% are detected.
All right, Dr. Gunjan, what is the difference between pancreatic cancer and pancreatitis?
So
how are both of them different?
No, both are completely different. Pancreatitis is the inflammation of the pancreas. That are usually 2 kinds. We call it acute pancreatitis, when it happens suddenly and then there is a prolonged course of the disease. Chronic pancreatitis, when it turns into the chronic disease. I mean, you have a lifelong process of a disease. So both has pain abdomen, but acute pancreatitis is limiting factor of maybe 3 to 6 months it will be completely if it is severe disease. Mild pancreatitis within 7 days it get cured. But chronic pancreatitis is lifelong disease. You will have a pain, recurrent pain abdomen, then diabetes mellitus, and then there is a malabsorption. These are the 3 common symptoms of chronic pancreatitis.
Does it somehow always lead to cancer, pancreatic
cancer?
So
chronic pancreatitis is a risk factor for chronic pancreatic cancer. So if any patient has chronic pancreatitis, then they have enhanced chances of having pancreatic cancer later in a life after some sort of, maybe in Indian study shows that after 15 to 16 years of duration of a chronic pancreatitis, there is increased chances of pancreatic cancer. Pancreatic cancer is completely different thing. They have, one is the risk factors like as a chronic pancreatitis or other risk factors like a smoking or genetic syndrome, some of them. So cancer is, as a common terminology, what we understand, there is uncontrolled growth, as you have said.
Yes.
So there is uncontrolled growth in the pancreas itself. And it is very aggressive tumor and very difficult to treat because it causes a lot of fibrosis. So chemotherapeutic agent does not reach at the site of a cancer. So the therapy also does not kill the cancer tumors, cells. So that's the reason it is very difficult to treat it. So we should detect early and treat surgically till now.
Detecting early brings me to symptoms. What are the early symptoms that we looked out for? Is it always the jaundice-like symptoms that one faces? And also, when is it the time to see a doctor with regard to, fever or the early symptoms suggesting cancer ahead?
The symptoms are not very specific. Say the common symptoms are pain abdomen, pain in the mid-abdomen radiating to the back side because pancreas is situated back in the abdomen. That is one. It's a chronic pain, it's not coming and going type thing. And second thing is loss of appetite, because cancer cells eat away energy, and there are other causes why you should lose appetite. So nutrition becomes poorer, so your weight becomes less, weight loss. If it is more than 10% within 2 months or 6 months, then you should be worried about it. Loss of appetite, loss of weight, pain abdomen, and appearance of jaundice. So these are the symptoms, but if these symptoms occur in a risk population, like if it is more than 50 years, and suppose a person is diagnosed diabetic after the age of 50 years with these type of symptoms, certainly he has to look for pancreatic malignancy.
All right, Dr. Gunjan, in our report also we told our viewers about why pancreas are important for the human body. But can a person actually live without pancreas?
So, there are rare variants when there is pancreas in absent in human. We call it pancreatic agenesis, but they are very extremely uncommon. Sometimes post-surgical patients, when we remove the total pancreas, we call it total pancreatectomy. But you know, in these patients, the life is not so good, because you remove whole the pancreas, so the diabetes become unnecessary symptoms, and malabsorption also becomes unnecessary symptoms. So you have a comorbidities with it. You can live with, but your quality of life is very poor, because the sugar control is very difficult. Malabsorption that happens with, we call it steatorrhea, that's also very difficult to control in these group of patients.
All right, Dr. Das, is sepsis common in pancreatic cancer?
No, you should understand what is sepsis. Sepsis is that the toxins produced in the body because of pathogenic bacteria. So bacteria has to be there, or virus has to be there, or some microorganism has to be there to produce sepsis. So mostly the bacteria. It is not a case in pancreatic cancer until unless it is complicated. The bile duct and the pancreatic duct, they join inside the head of the pancreas, and then finally they enter into the duodenum and pour their secretions for digestion. So if there is a head of the pancreas is the commonest site for pancreatic cancer. Pancreas has head, body and tail, as Harshita showed. So if there is a cancer at the head of the pancreas or near the opening of this bile duct and the pancreatic duct, then the bile duct gets obstructed, or the pancreatic duct gets obstructed. So there is a tendency in our body, wherever the flow is obstructed, bacteria starts growing. So then the infection starts, then they go for sepsis. So sepsis is a condition wherein the bacteria produce toxins, and then the symptoms of fever and all the things they appear.
All right, Dr. Gunjan, apprise us of the medical advancements that have been made in this field in India.
So, if you look at the incidence and prevalence of pancreatic cancer in India is very low as compared to the Western population we have. So, not many centers and not many people or scientists are involved in the research in the field of pancreatic cancer per se in India. But there are some advancement is being made now for pancreatic cancer, but there is no breakthrough advancement either in diagnosis or early detection.
World-class treatments are available here in India?
Sorry?
World-class treatment, efficient treatments are available here in India?
Yeah, of course it is definitely whatever
cost-effective treatments as well.
Available in the West, that is available in India. But as we say, there are certain tumors like blood cancers in which there are breakthrough advancement.
Right.
But in particularly in pancreatic cancer, there is no breakthrough
advancement. So research and
advancement.
development is still
Ongoing.
Continuing. All right. Dr. Das, to what extent do lifestyle changes help in preventing pancreatic cancer?
Yes, lifestyle, because most of the causes are because of the lifestyle change. You gather fat in your abdomen, the belly, that is called central obesity. This is a problem of the lifestyle. Having diabetes is a problem of lifestyle. And it is known that if you are sedentary worker on the table or chair, then these things can happen. And then the nutrition, the food intake. The processed foods, the red meats, the junk foods, they are all the saturated fats, they are all responsible for development of cancer in many areas, including pancreatic cancer. And to add to that, if I may add that researchers are now started to show that the pollution If the ppm is 2.5 or less, the dust particles which have less than that can enter into the circulation through the lungs. They can cause the cancer. So, pollutions outside, pollution inside, you have to control both of them.
Yes. All right, Dr. Gunjan, also very quickly tell us more about pancreatic cancer in the sense that is it age or gender specific?
So it's not a gender specific, slightly more common in women, but age is usually in the older age group of patients.
Is it genetic also?
So only 10 to 15% of the cancers are, we call it as a group, as a familial group of cancers, in which only 5% are genetic inherited syndromes. So in that group, they have other risk of development of cancer like breast cancer, ovarian cancers or something like that. But the familial cancers, when there is no defined genetic cancers, but it runs into the family. At least if there is 2 first-degree relatives are diagnosed as a pancreatic cancers, then we call it familial pancreatic cancers. And it happens in old age, but those who has having inherited genetic syndrome and having prior risk factor like chronic pancreatitis, in that group of a patient, it can develop early slightly.
All right, Dr. Das, pancreatic cancer spreads aggressively. Which are the immediate organs that are at risk when a person is affected by pancreatic cancer?
For any malignancy or any cancer, the first thing happens is the nearby structures. So near the pancreas, we have the lymph nodes, which are actually resistant organs of the body. So they are affected. The nearby organs in pancreas, with the pancreas, are the stomach, are the duodenum, after that the small intestine, and the lymph nodes and the blood vessels, which are very important. The blood vessels which are traversing through the pancreas, behind the pancreas and a little bit through it into the liver. So there is the blood vessel to the bowel, the blood vessel to the liver. All these are can be involved with progressive stage of the disease and the where the tumor is, the localization. So if it is little bit away, it takes time. If it is near it, it involves very quickly. Body of the cancer, the body of the pancreas, also the cancer occurs in the body of the pancreas is more dangerous than in the head.
All right.
So those are the nearby organs that can be involved. The spleen is nearby, it can be involved, and there are distant metastasis. Means the tumor passes through the blood vessels or the lymphatics. It can go to the liver, the commonest site, the lungs, bones, nearby areas. Then you have the symptoms pertaining to those metastasis.
All right. Dr. Gunjan also, sir told us about spreading of cancer. But then if once treated, can it reoccur?
Yeah, so pancreatic cancer is very notorious for even after treatment for recurrence. That's the reason that survival is less. So almost it recurs in most of the patients.
Is it always detected through a blood test?
So when patient underwent surgery, so that is curative treatment we call it in stage 1 and stage 2. And later on these patients are followed up regularly with the blood test and imaging based tests to detect if there is a recurrence of a tumor.
All right, so that was all the discussion we had on pancreatic cancer, but we will have a quick rapid fire round to get some myths cleared. I request our specialists to kindly give very crisp answers. Dr. Das, first to you, pancreatic cancer is always fatal, is it?
Yes.
Dr. Gunjan, all pancreatitis leads to pancreatic cancer?
No.
Jaundice always means pancreatic cancer, Dr. Das?
No.
It is a fast progressive disease,
Yes.
Dr. Gunjan?
Yes.
Acidic diets accelerate cancer, Dr. Das?
Not acidic diet, but certain diets like processed foods, as I said, saturated food, etc.
Once operated, pancreatic cancer does not recur, Dr. Gunjan?
Yeah, it can recur.
All right. Thank you so much, both of you, for helping us understand pancreatic cancer better and putting your insights and perspective into it. Thank you so much for joining us on Wellness Watch this afternoon.
Thank you.
So, the pancreas may be paltry, but its cancer is not. It demands big attention. Know the symptoms, understand the risks, and act early. In the fight against pancreatic cancer, awareness is action, and action can save a life. Early detection is not just a medical advice. It is the line between losing time and gaining a fighting chance. On that note, we'll end Wellness Watch here. Thanks for watching. Bye-bye.